people about Ebola?
So you also appreciate that there are quite a lot of other conditions that are troubling Zimbabweans in terms of causing illnesses and deaths. And we still maintain that we are not an Ebola country. Much as we want our population to be aware that there is an Ebola outbreak happening, which may eventually come to us, we also don't want to cause panic. So I wouldn't say we are planning on campaigns as such, but we are, periodically giving information, and we continue to improve on that communication strategy. We are in the process now of translating some of the materials that we have produced into local languages, so that even the people that cannot read and comprehend English very well can also be able to get information in their language. You may have seen a few SMSs on Ebola. Those ones will continue just to inform people and raise the awareness, and also dispel some of the myths and misconceptions. I'm sure you have heard that there's been a case of Ebola here and there, but at ministry we actually like that kind of information, because for us it means people are actively looking for these cases. And as I said, the earlier you detect a case of Ebola, the better for everybody. So we take the rumors quite seriously, and we use them to, improve our systems.
Now, one thing that we've heard is that in the case that the Ebola virus does come to Zimbabwe, somebody comes through with the Ebola virus in Zimbabwe. You've talked about the 21 days of monitoring of a person who's traveled to an Ebola, to a country that's being affected by Ebola. They will be quarantined at Wilkins Hospital if they have the Ebola virus. Is that true?
Yes, indeed. And when we talk about Ebola, this is one of the few diseases that we indeed use quarantine and isolation. In the majority of cases, we try as much as possible to do the treatment and management within the community. So, yes, indeed, you will remember that according to our Public Health Act, the urban and rural local authorities are mandated to manage infectious diseases, and Ebola is one of them. So the very first groups that were trained was Harare City Health and its workers, and the director has really taken it up very seriously. There's a team that is on standby, and in fact they do drills once or twice a day. It is very important that even the health workers know how to behave around an Ebola person, including the use of personal protective equipment. In the outbreaks that have happened, we've had official reports of 216 health workers succumbing to Ebola, and 377 getting the infection. So that's a very, very high price to pay in terms of healthcare workers. And it's a very sad situation where somebody who's trying to assist a patient dies in the process. So we are really drilling our healthcare workers in the identified treatment centers to make sure that we don't come to that. We come to the issue of just managing the patients, but never at the expense of our healthcare workers.
Now, take us through the screening process. We're told that there are Ebola detecting equipment that have come through. What does the detecting equipment comprise of? Just take us through the screening process that is done when somebody's entering Zimbabwe.
Okay, thank you. So thanks to the ICTs and modern day technology, but Glenda, these are not Ebola detecting equipments. They detect fever, and fever is one of the parameters that exhibits in Ebola patients. So yes, indeed, some people may be screened and be, found to have a high fever. It doesn't mean that they do have Ebola. It just means that we need to make sure that Ebola is excluded in those patients, and then they still go on to get investigated for whatever is causing the fever. But let me just say that we are very grateful to some of the corporate partners that have come on board to support the Ministry of Health and indeed the government in improving the screening and surveillance at the ports of entry. So as we talk, the Harare International Airport, which is our busiest airport of entry into the country. And as I said, there's 8 airports of entry. So it's one of the first to get that state-of-the-art equipment, thanks to support from Mimosa. So as people disembark from the plane, In some cases, they will have already been informed that they are going to undergo screening. We still apply the paper-based questionnaires in the event that they've traveled from any one of the Ebola reporting countries. And then they are screened through a static thermal detector. It's really just walking through, and if it detects a temperature above 38 degrees centigrade, then you are taken aside just for a bit more, checking up. Yes. Some of the devices are handheld, and this is what has been recommended by the World Health Organization. We do not want the use of contact thermometers, the one that we used to when we were younger. It would be stuck even in your mouth or under your armpit. Yes, so we're trying to discourage even the private practitioners or other health practitioners from using the contact thermometers, because as we said, Ebola is not airborne, but it is indeed, transmitted through direct contact. So these devices are going to be in use at the major air and ground ports of entry in the country. So expect when you are coming into Zimbabwe to undergo some kind of screening. It is good for you, and indeed it is good for everybody in Zimbabwe.
Can somebody say, I do not want to go through the screening process, or it's a forced matter that everybody who's going through Zimbabwe goes through it?
So normally we don't want to use the word force, but I think the other side of it has been people expecting to be checked out and then nothing happens. We do have laws in this country, and I did allude earlier to the Public Health Act. There are also immigration and other laws that govern the conduct of persons either entering or leaving the country. So I think it's really part and parcel of the sum total of our laws in Zimbabwe.